Hello, and welcome to the Helo Podcast, brought to you by the ECW Podcast. This is a series in which we spoke with patients, doctors, nurses, and the front office staff at Grove Medical Associates in Auburn, Massachusetts, and chronicled their progress. Our host for this series is Amber Asaro, and welcome to Episode 3, The Solutions.
So far, we've gotten to know the patients and the health conditions in this project. Now let's turn attention to the technology that was used to make it all possible. I asked Dr. Steinhubel, Director of Digital Medicine at the Scripps Translational Science Institute, for his opinion on how home health monitoring fits into the big picture of healthcare.
I believe that wearables and variety of home-based sensors are going to play a dominant role in the future of health and of healthcare. There's a long ways to go until we get there, but the potential to allow us to individualize the treatment to be much more responsive to changes in wellness, whether it's somebody with a chronic condition or without, are just dramatically enabled through home health monitoring. And so it's something that we'll keep getting smarter at, we'll keep getting better at, and keep building towards. And it may take a decade until we've really got it. It becomes the norm, but it's the way that healthcare and health will be going.
Many different technological components had to come together for this project to work. They break down into three main elements: the devices that measure health metrics, the app that lets patients see all their data, and then the way physicians get to review that information later. After exploring each of these, we'll check in with the experts on where all of this might be headed in the future. First, you have the devices themselves that patients use to measure health metrics, like their activity trackers, blood pressure cuffs, and blood sugar monitors. Two of our partners offered their devices to the patients so they could take part in the project.
My name is Joe Catalano. I'm the Director of Enterprise Solutions for iHealth. iHealth is a wholly owned subsidiary of Andon Health Corporations, which is an enormous Chinese manufacturer in Tianjin. About 5 years ago, they decided to carve out a branded portfolio of devices for heart health and diabetes care. And they started selling the devices into the consumer placement. In fact, our blood pressure cuff was the first medical device to ever be sold in an Apple store. And our portfolio consists of blood pressure cuffs, diabetes products, glucometers, and then also weight scales and activity trackers, and also pulse oximeters.
My name is Robin Swanson. I am responsible for business development at Withings. We make products that help individuals track and improve certain important aspects of their health. For example, we have a wireless weight scale, we have two different types of activity trackers, a blood pressure cuff, a sleep tracking system, and our home monitoring system.
Most of the patients used blood pressure and blood sugar monitors from iHealth, but some used ones they already had. Patients got to try activity trackers from both iHealth and Withings, though several already had their own. Listen to Jim and Barb start to explain how the trackers have not impacted them, and then sort of change their minds.
Well, Amber, I don't know how to tell you this. We're very interested to see what happens, okay, and what our reactions are to certain things, but we're not changing anything. We're just okay. You did 10,000 steps today. Good for you. All right.
Right.
What are you going to? But I don't think we're changing. Barbara, are we changing anything?
Yes and no. I think we will.
All right.
You know what I'm saying? Because you just think more about, like today I've been at my desk all day, and I know I don't have my steps in, but that's just, the days are like that. The weekends are always more active,
Yeah.
which is probably what you're finding too, Amber, I would imagine. But maybe it will start to really say, okay, now we've got to get out and, walk in the morning or walk in the evening or do something more on the days when we're not playing golf or going to the gym or whatever it is that we're doing actively. But I think, Jimmy, too, in time, it's making me more conscious. I think it is you, too, of, wow, look where my numbers are here. And I think on the same note, the blood pressure monitor has been good, too, to know where, that's good because you do see a real time more often there.
The truth is that, it does encourage me to be a little bit more active. And it's nice to know. that what's going on.
And you even said that, Jim. You said, wow, I didn't realize I was, where I was with some of these things as over the course of a few days. Remember?
You'll remember that Mary Ann works in a restaurant. Since she couldn't wear anything around her wrist that might get caught as she bustled around, her activity tracker was clipped to her blouse, and she liked that it invited conversation.
And I'm going to tell you, I deal with a lot of people at work. I know I have a lot of employees and I have a lot of guests, and they all, because they see it on me, they're like, what's that? And I tell them, they go, oh my God, where'd you get it? I'm like, I got it from the doctor. And they're like, oh my God, I can't believe they did that, to help you, to do some things like that. I was like, yeah. And they actually look it up and want to know what their, brand is and all that.
So you're a walking billboard, huh?
Yeah. So I thought I'm having fun.
Based on his experience with the blood pressure tracker, alerting him early to poorly controlled blood pressure, Jim is encouraging his friends to get on board.
Yesterday I spoke with a friend of mine who's had some health issues. And I was telling him about it, and I said, with all the stuff you've been having, this watch, it looks okay on you. It's nothing, it looks good. You can wear it with a suit and tie like you wear every day to work, and it doesn't look outside of anything different. It only cost $149, but it tells you what your exercises are, what your calories you're burning, how many hours of sleep you're getting, when you wake up at night, how quickly you fall asleep. There's just so much information this can tell you, and then you can send it off to your doctor. He goes, $149 isn't that much money. So I said, I just verified the fact that people would be willing to pay that,
right.
Which is good news for Withings and iHealth and everybody else. So I think that's the other thing. The fact I got it for nothing, I don't know what the blood pressure costs, but at this point, when that one wears out, I will go out and buy another one because I see the value of it. And anybody can use it. I mean, I can take it and I'll see what their blood pressure is on my phone, and then I can just, delete the reading saying, don't record this.
Right.
But I can tell somebody what their blood pressure is at if they're having an issue, so I could use it for anybody within my family as well, including my children. So I just think it's worth it.
The activity tracker, no matter what I do, I can't get the thing to sync. Actually, that activity tracker, I think, would have the same kind of impact to me
right.
as the blood pressure is, in that knowing what I'm not doing would make me do more. If I have a target and I'm not reaching it, then it's a constant reminder that I need to add that time into my life somehow. And while in the back of my mind every single day is I should go to the gym, the reality is, everything else kind of gets in the way. But if I have that number in front of me, it might actually make me go more often.
We were able to get Laura another activity tracker a few days later, so she could start seeing her daily steps. Many of the patients commented on how just having a device or a number at the end of the day increased their awareness about their activity. Here's what some of the experts say. First, the Grove Medical nutritionist Elise, then Dr. Steinhubel.
If we can keep in the forefront of the mind what I need to do to stay healthy, they're much more likely to do it. And giving feedback. And it's fun because we can, with our group, even have a little competition of, who had the most steps for the month, things like this that people sometimes buy into. And it makes them be more active. So we need to find out what motivates each one.
There are certainly people who relish the opportunity to monitor themselves very closely. But it's not necessarily age. I haven't found an age dependence or chronic condition dependence. If anything, I would say it's the people most likely to not need to monitor themselves. So they're the people who already run several miles a day, who eat very healthily, who really want to track themselves. So we have to look at really what it is. The consumer of healthcare, which is all of us in some version, but what that individual really needs, and then how we can address that and how we can make that better. And in some, we know that in some ways competitions help, but in others the competitions are actually a disincentive where people don't like it.
Here's Karen, who works at Grove Medical. Were there any surprises with the activity tracker?
More discouraging because I'm so sedentary. I really sit all day. So
See, I thought in nursing.
I'm not. I work at the front desk.
Oh, okay.
So I can't wander too far, but I do try to play games with myself. You know, like with getting up, or even if I have like 2 or 3 things, I'll only deliver one at a time. Walk around. We have a little circle upstairs, so I'll walk around it, go the opposite way. So I do find I try to play games, you know, to increase, you know, the steps. The trackers, I find it's good. I mean, I had one thing happen with it where the battery discharged. I charged again, and I got the wrong dates and times, and so they replaced it. But that's been fine. And the blood pressure monitor is wonderful. It's easy to use. It just takes a few minutes. It's wonderful.
Ray is a medical assistant at Grove Medical Associates. He got inspired by what he saw his patients doing and has made some changes himself.
I have the activity tracker, and I wear it every single day. Actually, my mother has gotten involved. She got one, and you know, my favorite feature on them, I guess I would say, is that you can add friends on the app, and you can compete. I want to say compete, but I don't want to sound too over enthusiastic about that. But just, you know, kind of say it's good motivation, you know, to have someone there who's, you know, at the same time they're going through the same thing as you, but it's really nice to have someone else who, you know, you can check in on each other. You can say, you know what, I beat you today, so you need to beat me tomorrow, and that kind of thing. As much as it's, you know, you don't want to get too competitive with it, but I know for me, that was a huge step. I saw the first day when I wore it, I only took like 4,000 something steps, and I was like shocked. I thought it would have been way more than that. I'm on my feet all day. I'm running around rooming patients and running down to the lab and blah, 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 and was shocked. So that next day when I only took the same, I said, you know what, I need to go for a walk. I need to go for a run. And it was just a nice way to kind of say, I thought I was doing better than I am. Here's what I need to change. And I've gotten up to almost 8,000 steps, you know, so I'm almost doing double what I had been doing, you know, and it's just a really good way to keep yourself on track. That's been a really helpful aspect as well.
Sometimes, though, patients get really focused on that number of steps.
And in some way, too, we're golfers, and I mean, I walk and carry my bag, and the bag's, what we figure, 22, 23 pounds, but it doesn't record that weight that I'm carrying around for 18 holes. It records the steps, which is great, and I can go over 10,000, you know, on a busy day with golf easily, and then come home and mow the lawn, but I don't get the weight-bearing register.
Is that so? You want credit for everything you do?
Yeah, and I think that's sometimes the thing. And washing windows, mowing the lawn, doing, you know,
constantly.
I mean, I'm constantly, you know, in the rainy day the other day, just cleaning out the cellar, and you know, I'm constantly in motion, moving, painting, doing stuff, but you're not doing the steps.
Right.
And then you're like, okay, well, I'm exhausted, but.
Yeah, that's the other thing, you know, that you wish. I mean, I worked outside in the stupid heat yesterday in the garage and lifting and moving and mowing the lawn and doing all these crazy things. And it counts the steps, but it didn't count all the other activity, just like when you go to the gym and you do your weights and stuff too, hon. It doesn't count the, you know, that exertion. Which
the Hilo app has that ability for you to log. The Hilo app that you downloaded from us, where it's pulling the iHealth info in, but there's another tracker that you can activate. It doesn't have a device that automatically does it, of course, but you could be entering your activity, and you can choose your level of strenuousness,
on the
exertion.
Hilo app. Okay.
Yeah.
Okay, all right, gotcha. We didn't go that far. See, it's a learning process.
This takes us to the second aspect of the technology behind the project, the app.
One thing that iHealth recognized early on was make great devices, very beautiful devices, great design, easy for patients to use, but we need a partnership with medical expertise to use that data to make it make sense for patients. And that's where eClinicalWorks and Hilo come in. So our data flows from our device into our ecosystem and then out through our API. We partner with just about any organization that has clinical relevance to take that data and use it. And Hilo has figured out a way to do it seamlessly and painlessly and quickly. The data flows right from the patient's blood pressure cuff or glucometer into our ecosystem out into the eClinicalWorks Helo system, and then it makes it useful for the doctor and patient to communicate about that when they're together at a engagement or appointment. So, for example, with the blood pressure, they're going to get systolic and diastolic pressure. They're going to get heart rate. There's also information within the application that's going to tell them that they're in the normal range. They're maybe moderate to hypertensive or severe hypertensive. And then that data is going to flow into Helo. And then from there, so we're going to send the data and the information that's necessary for the doctor to make a good clinical assessment on whether or not they should contact the patient, or if there's a tweak to the medication that needs to be done or something along those lines.
Joe is talking here about an API, which is an applications program interface. It allows different software to communicate with each other. And this is really important because patients might choose a Fitbit activity tracker, let's say, and an iHealth blood pressure cuff, then a Withings scale. In the past, someone monitoring all of this information at home would have to carry around a piece of paper and log everything, and remember to bring that to their doctor visits. Now, Bluetooth and Wi-Fi technology allows many devices to sync automatically. But even in that common scenario, where a person has several different devices, their information would still be in many different places. The Helo app brings this information from multiple devices into one place and allows patients to make manual entries from analog devices too. It also lets them send messages with their providers and review health records and test results. Robin from Withings has a simple explanation of how the devices in the app work together.
Again, our products are so easy to use, and with our open API, it allows the data from our product to flow directly into the Helo app. This also is an easy way for individuals to be able to track activity and to be able to share it with their provider, and for their provider to be able to monitor their progress over time and make small recommendations to help the individual improve on activity or sleep, or making small changes to even furthering the distance that they walk.
A lot of the participants mentioned that they found this part motivating, that they liked that they were held accountable by the devices because their physician had the ability to review this information with them later. While this sounds great to the patients, not all providers are as thrilled about the idea of patients generating this huge volume of data. I asked Dr. Steinhubel for his opinion.
I think that it's a reason, well, it's worthy of a lot of thought and a lot of discussion, but I'm not worried about it. We just have to become smarter and make the best of these data. And again, we have to, a lot of this data is data that we've never had before, and we don't know what to make of it. So imagine a watch that measures your blood pressure continuously every single beat. Well, I don't think anybody in the world can tell you right now, okay, what is a normal blood pressure when it's a parent who's late picking up their kid at school and they're stuck in a red light and are very anxious and going. Maybe it should be 180 over 100, maybe it should be 120 over 80. We don't know, and so we have to learn a lot, and that's going to require collecting a lot of data. The capabilities of making sense of these data are there. We just have to, as we look at the data, realize that we're going to learn more and more and more as the more data that we collect, and as we do that, we'll understand better, okay, how do we simplify this so that when a patient wants their information, instead of just getting, here's your continuous vital signs for this, they get a nice summary. When a doctor sees a patient, or if a patient has an acute emergency and a physician wants to see their general well-being, that they get a nice one-page summary of that distills down potentially a year's worth of near continuous data monitoring, which may not be necessary. It may not need to be continuous, and that's the other thing.
Which brings us to the third aspect of the technology in this collaboration, which allowed the providers at Grove Medical Associates to review the data patients were collecting. They would be using a new feature called the Helo Hub in their electronic medical records system. Even the patients were curious how this would work during their next visit.
Okay, they have access to all this. Now, I'm sure they don't have the time. I don't know, but I would think they don't really have the time to look at this.
Good point, Jim. I asked Dr. Weinstock.
Right. I think what I try to do is, knowing they're coming in, just, I mean, for better or for worse, I mean, like I said, I have two kids, so I'll often be working, up until 5, 6 o'clock, and then I'm home for activities or whatever we're doing. I have dinner, and then I sit back down. So at night when I'm finishing up my work from that day, I might look ahead and say, okay, well, Jim's coming in tomorrow. I'm going to pull up his tracker information. So I try to get and it's relatively easy to click on it. Literally, before you walk in, maybe it takes 30 seconds to pull up the information when you're walking in. Patients I think they want to hear some positive feedback. If they've lost weight, they've been active, if their sugar is better controlled, they love to hear. I think they really like to hear that reinforcement. So it's a lot of info, but I think there's ways within eClinicalWorks that you can really do it quickly and efficiently, so it doesn't take up a lot of time.
When you open the Hilo Hub, do you typically just look at the summary view, or do you look at every reading?
I put to the summary and I'll scroll across with the cursor to look quickly. Once you get an idea of the trend, it's pretty like blood pressure, especially once you see the trend, you know where you're going, and you can kind of see if some highs and lows. But I really don't think it. And again, with the same thing with the trackers, but the steps, it's pretty easy to look at that information and get a pretty good idea pretty quick without working too hard at it, where they stand. They keeping their activity level stable or not, or ups and downs, and most cases will know. They'll realize, on weekends I don't get out as much as I should, or I don't walk, or I'm not careful. And people don't realize how active they could be at work, depending on their job. They might do 8,000 steps during the week each day.
So we've looked at the devices patients use to track their health at home and seen how individual preferences can vary on what works for them and keeps them motivated. We've seen the need for an app to bring it all into one place for the patients to make sense of it. And then we've seen how the physicians can review the information from a high level next time they talk to their patients. This is already happening. But we're in the middle of a technological revolution. So the big question is, where should healthcare be headed to leverage what patients are already tracking at home? First, we'll hear from Dr. McDowell, our nephrologist in St. Augustine, Florida.
It's a great question. Well, like you were mentioning, just documenting their blood pressures and then, educating them on what a good blood pressure is. I think that we can use technology to create more awareness and better education, so patients can achieve, the goals of good blood pressure control. And in my case, for my patients, that's chronic kidney disease and also less cardiovascular disease.
Dr. Steinhubel weighs in.
And then a lot of the people that are going to listen to this podcast are probably healthcare providers, and they're thinking about whether they should be dismissive of the home health monitoring devices that their patients are just going out and purchasing anyway, or how they can incorporate that into their therapeutic approach. What would you recommend as far as how they should be adjusting their discussion visits, like you mentioned earlier? What should the doctors be doing?
It's a really good question, and it's an easier question to answer 5 years from now than it is a month from now or 5 days from now, because right now in the current, and I'll steal the term that my CEO says, in our perversely incentivized, financially incentivized healthcare system, anything that right now mobile health technologies for the most part are just an extra burden on providers and have no proven benefit. So I think it would be very difficult for most providers right now to incorporate these technologies. And we've had some way to measure physical activity for ages, even back to pedometers, and we didn't use those. It would be nice, and there are very small handfuls of healthcare systems that do collect activity data, typically just subjective, how often do you walk, less often the direct data. But for providers to do that, they need the infrastructure. The providers, for the most part, are already overwhelmed by having too much information, not enough time to see their patients, and not enough automated support to accomplish that. Electronic health records are tools to allow improved billing, but don't help the provider provide better care. And so this long diatribe leads to that it's really, I think it's very difficult to expect a provider to enable their patients to meaningfully use home monitoring technologies. In rare situations where they have the ability to develop systems that can do that, some simple things like just home monitoring of blood pressure, which has been shown when it's tied in with near real-time feedback, and that's important.
Then Dr. Weinstock.
A couple things that need to happen. I think one is sometimes to engage certain physicians when you have office staff that is maxed out doing the routine stuff, the routine cholesterol, the routine A1Cs for diabetes, the colonoscopies, the pap smears, the mammograms. You have office staff, and most offices are work extremely hard and are taxed. And the only way to really help them is to maybe having access to more of the financial backing. So if these trackers become a way to increase revenue, then it will allow offices like ours to hire more people to be out there managing the blood pressure, the sugars, and having more patients, having access to trackers is huge. I would love for Blue Cross or Cigna, United Healthcare to offer Fitbits to their patients. Say, you know what, you're a diabetic, you have borderline hypertension. Let's give you a Fitbit. You can talk to your doctor can track your activity. They can track your sleep pattern. They can track your caloric intake. That's where I think I would like it to go. I think I would like to see the physicians, the insurance companies, and the patients work together. So I think that in the future, I guess my hope would be that the insurers realize the benefits of the trackers, that expand the role of primary care to preventative care.
All of the physicians interviewed seem to want the healthcare system to embrace the possibilities of home health monitoring. Join us next time to check in with the patients one more time.
I really didn't reach a lot of my goals, but it actually did something else for me. Instead, I did lose weight. I've actually lost 24 pounds through this whole thing.
I wanted to be more active. I wanted to lose some weight. I didn't really lose as much weight as I wanted to, but I know I will lose more.
They'll review their goals and see how they did. Some exceeded their goals, some didn't, but everyone had a unique experience in monitoring their health at home that they wanted to share.